I first started developing it when I was in college. It was my freshman year.
My symptoms are tingling is there, spasm is there, and I'm unable to walk.
It was paralysis on the total left side of my body, so it affected my vision. I couldn't talk, it affected my speech.
It's had a very big impact on my life.
I was a tennis player, and I was a biker.
I used to love to hike in the mountains.
I used to do things with my kids that I just can't now.
Now, my little granddaughter is 3, and she's seen me fall, so she's kind of scared to be with me almost.
What I miss deep in my soul is the ability to socialize with my friends spontaneously.
MSRCNY stands for the Multiple Sclerosis Research Center of New York. We created that to have an institution devoted to research with minimal bureaucracy. No outside interference, no red tape. Let's all just focus on the research.
What we do here is solely dedicated to finding the cause of multiple sclerosis so that we can find the cure for multiple sclerosis.
Nowhere else I know has the same capacity to do the research that we do as well as the patient care that our clinicians do.
The IMSMP is the International Multiple Sclerosis Management Practice.
And that provides the inspiration and reminds us of the challenges and why we work so hard in research.
Step, get your balance, and take the next step.
MS is a disease that we don't understand everything about. And in order to do our best coming up with treatments and a cure, we need to draw from all available fields.
Being able to discuss cases with other attendings in a group conference and with the cognitive division, with the physical therapists, with the social workers, and with the nurse who might be helping care for the patients. We're all in one center. That's unique, and that's what I love about this place. On the research side, you have the laboratory personnel, the PhDs and the research associates working with them, and so that when we have an idea, we can go back to the laboratory and ask them what they think about something.
So we get to come up with ideas based on what patients are experiencing and take those directly into the lab to do some research.
Patients get the services they need, and research endeavors are geared toward what's important for multiple sclerosis patients.
It creates an atmosphere that really is, I think the researchers appreciate more than anything else.
Here we have a lot more freedom to do the research we want to do and to target that specifically to our patients' needs and other MS patients' needs.
Can you hold your arm up there? We have been very successful with treatment for multiple sclerosis, but all the treatments work for controlling the disease activity. We have nothing at present to reverse the disability that patients have or to regenerate the nervous system.
How are you doing, Carol?
At MSRCNY, we believe that stem cells are the way forward for treating MS and hopefully finding a cure.
What I'm speaking about is giving you neural stem cells, neural progenitors, brain stem cells, and that is to regenerate the myelin and the cells, hopefully. That has never been done in the United States. Stem cell research represents one exciting new field which we can explore and develop.
So these stem cells are of a particular interest to people because you can get them from your own bone marrow. So you can find the treatment that you need in your own body.
You don't have to worry about any of the issues of rejection that can happen when you transplant something from another person's body to your own nervous system.
Right now our research in the lab shows extremely promising results for stem cells.
It certainly has the hope that I'm looking for to actually improve some of my symptoms.
Hopefully it will result in regeneration and repair so that patients who have lost neurological function like the ability to walk can regain at least some of that ability, and if not all of it. We've had a series of expansions. I started off with 200 square feet, and then we went to 14,000 square feet, and the present facility is at 34,000 square feet, and now we are trying to expand to an additional 45,000 square feet. So it will be the largest MS center in the world if this expansion goes through.
We want to be able to offer comprehensive services to our patients here.
Physical therapy, occupational therapy, yoga.
The expansion is going to include an MRI facility. It's going to include a new research labs.
We're going to have a new wellness center on the 3rd floor, and that's very important in my eyes for treating MS patients.
It will allow patients to ultimately utilize some of the technology out there, whether it's virtual reality.
We want everything that a patient could possibly need under one roof.
And we're not going to stop because of difficult economic times, but we need the help of people who can afford to donate.
If I had $50 to $60 million, we could solve this problem by exploring every avenue in 3 or 4 years. I know it will happen. How it will happen is what we'll find out, but we'll raise the money to do it.
I work here because I'm inspired every day by the doctors and the staff and the commitment that everyone that walks into this center has.
You can't do this work and work this hard and not love what you're doing.
I wouldn't be in this field if it wasn't for Dr. Sadiq.
Dr. Sadiq's passion for this work is contagious.
I have met many people who are smarter than me, who are more gifted than I am. I've certainly met many people who are better looking than me and who have less weight and are taller. But I've never met a person, and I can sincerely say this, who has worked consistently harder than I have.
Dr. Sadiq makes you feel that you can do it.
Dr. Sadiq is encouraging.
There's no one like him. First of all, most importantly, he kisses me on both cheeks when he sees me. What's not to like?
I'm so fortunate, even having MS, that I'm able to come here.
The dedication and the commitment that we have here, that the doctors have here, that the nurses have here, the social workers, the physical therapists, the administrative staff, it's all for the patient. It's all about the patient. And if they're not happy, we're not happy.